टू मेडिकल ट्यूबर। तो फ्रेंड्स आज का जो हमारा वीडियो है वह है यूपीएससी इसिक नर्सिंग ऑफिसर एग्जाम 2024 जिसका आंसर के एक्सप्लेनेशन के साथ लेके आ चुका हूं। तो चलिए फ्रेंड्स स्टार्ट करते हैं आज का हमारा वीडियो, जिसमें हम देखेंगे नर्सिंग ऑफिसर जो यूपीएससी इसिक के द्वारा 7 जुलाई 2024 को एग्जाम लिया गया था उसका आंसर की है। ये जो क्वेश्चन पेपर है वो सेट बी का है और क्वेश्चन नंबर 1 to 6 अभी अवेलेबल नहीं है, इसकी वजह से क्वेश्चन नंबर 7 से हम स्टार्ट करते हैं। क्वेश्चन नंबर 7 है विच वन ऑफ द फॉलोइंग मेथड इज द मोस्ट अप्रोप्रिएट फॉर फीडिंग द बेबी बोर्न एट 31 वीक्स ऑफ गेस्टेशनल। तो ऑप्शन नंबर ए इंट्रावेनस फ्लूइड एंड ओरल फीडिंग, बी ओरोगैस्ट्रिक और नेजोगैस्ट्रिक ट्यूब फीडिंग विद ओकेशनल स्पून और पेलेडाई फीडिंग, एंड सी ए इंट्रावेनस फ्लूइड विद ओकेशनल ओरोगैस्ट्रिक या नेसोगैस्ट्रिक ट्यूब फीडिंग, एंड डी टोटल पेरेंटल न्यूट्रिशन। एंड इसका जो करेक्ट आंसर फ्रेंड्स द मोस्ट अप्रोप्रिएट मेथड फॉर द फीडिंग ऑफ 31 वीक्स ऑफ गेस्टेशनल ऑप्शन नंबर इज द बी ओरोगैस्ट्रिक और नेसोगैस्ट्रिक ट्यूब फीडिंग विथ ओकेशनल स्पून और पेलेडाई फीडिंग। And our explanation, babies born at 31 weeks of gestational are preterms and often have immature suck, swallow, breathe coordination, make oral feeding difficult and sometimes unsafe due to the risks of aspiration. They also have underdeveloped gastrointestinal system that may not handle full oral feeds immediately, and orogastric nasogastric tube feeding is the preferred method because it the allow for safe and controlled delivery of nutrients directly into the stomach. This method ensures the baby receive adequate nutrition without the risk associated with oral feeding in such premature infants, and occasional spoon or pelladia feeding can be introduced gradually as the baby shows readiness for the oral feeds, typically indicates by the development of better suck, swallow, breathe coordination. This combination helps transition the baby towards full oral feeding while ensuring nutrition need or met safely. So correct answer number is answer number B. Next question number 8. A 14-year-old child has been admitted with the complaints of fever, headache, chills and vomiting. He has been provisionally diagnosed as a case of bacterial meningitis and has been advised lumbar puncture for the examination of cerebrospinal fluid CSF. Which one of the following variation in CSF cerebrospinal fluids will confirm that the child has bacterial meningitis? Option number A neutrophils and protein contents elevated, B color of CSF is the clear or slightly turquoise, and C lymphocytes are elevated, and D glucose contents is normal. And correct answer number is A neutrophils and protein contents elevated. And our explanation, bacterial infection, bacterial meningitis is the characterized by specific change in the CSF, the presence of the elevated neutrophils, a type of blood cells, white blood cells type is neutrophils, and increased protein contents are key indicators. Neutrophils elevated in bacterial infection, the body immune response involved and the influx of neutrophils to fight the infection. Therefore, a high neutrophils count in the CSF is a strong indicator of bacterial meningitis, and protein contents elevated often. Bacterial infection causes an increase in the protein levels in the CSF due to the inflammatory response and the breakdown of the blood brain barrier. So correct answer is the A. And option number B, color lymphocytes are elevated and glucose content is normal. It is why not the other option? Because color of CSF is the clear or slightly turbid, while CSF is the bacterial meningitis may be appear turbid due to the presence of the cell and bacteria. And lymphocytes are elevated more characteristics of viral meningitis rather than bacterial meningitis. And glucose content is normal in bacterial meningitis. Glucose content is the CSF is the usually decreased because bacteria eat white blood cells. A normal glucose level would not confirm bacterial meningitis. So correct answer is A. Question number 9. Which one of the following are true about the sign of good attachment in breastfeeding technique? Option number A, baby's mouth is wide open. Second, upper areola is visible, not the lower one. Third, baby chin touches the breast. And fourth, the upper lip of the baby is everted or turned outward. And fifth, baby's head and body are in one plane. And select correct answer 1, 4, 5, 2, 3, 5, 1, 2, 3 and 3, 4, 5 using the code. And correct answer is A 1, 4 and 5. The baby's mouth is the wide open and the upper lip of the baby is the everted or turned outward, and baby's head and body are in one pan. This alignment is crucial for the baby to swallow comfortable and maintain a good latch. Next question number is 10. During resuscitation, which one of the following medication is indicated initially if the heart rate of a newborn continues to be less than 60 per minute? After 30 seconds of positive pressure, ventilation and chest compression. Option number A, epinephrine. B, sodium bicarbonate. C, atropine. And D, dexamethasone. And correct answer number is A, epinephrine. एपिनेफ्रिन जिसको हम एड्रेनालिन के नाम से भी जाना जाता है, एड्रेनालिन को ही एपिनेफ्रिन के नाम से जाना जाता है, इज द फर्स्ट लाइन मेडिकेशन इज द न्यूनेटल रिसक्सिटेशन व्हेन अ न्यूबॉर्न्स हार्ट रेट्स रिमेन below 60 beats per minute despite 30 seconds of effective positive pressures, ventilation and coordinate chest compressions. Why epinephrine? Mechanism of action: epinephrine stimulates the heart and increases the heart rates by acting on alpha and beta adrenergic receptor, and indication is it is used to improve cardiac output and blood pressure is the critical situation such as cerebral bradycardia, unresponsive to ventilation and chest compression. So correct answer number is A, epinephrine or adrenaline. Question number 11. A 15-month-old child is brought to the OPD with diarrhea. He has sunken eye. The skin pinch goes back slowly and he drinks eagerly. As per the integrated management of neonatal and childhood illness, this child is classified as option number A, severe dehydration. B. Some dehydration, C. No dehydration, and D. Severe persistent diarrhea. And option number B is correct answer, some dehydration. According to IMNCI guidelines, the signs and symptoms of dehydration in children with diarrhea are characterized into three levels: severe dehydration, some dehydration, and no dehydration. Some dehydrations include sunken eyes. This is the common sign of dehydration. Skin pins goes back slowly indicates moderate dehydration. If it go back very slowly, it would indicate severe dehydration. Drinks eagerly so that the child is thirsty, a common sign of dehydration, but still able to drink eagerly. And severe dehydration includes signs such as the lethargy or unconsciousness, sunken eyes, not able to drink or drinking poorly, and skin pinch that goes back very slowly, more than 2 seconds. Some dehydrations include 2 or more signs such as the restlessness, irritability, sunken eyes, drinks eagerly or is thirsty, and skin pinch goes back slowly. No dehydration, none of the sign of dehydration. Severe persistent diarrhea. This classification is for diarrhea that persists for 14 days or more with or without dehydration. So correct answer is B, some dehydration. Question number 12. Which of the following baby is eligible for kangaroo mother care, KMC? Option number A, baby weight 1000 grams, cared in an incubator, baby with a birth weight of 2.6 kg or 2 to 6 kg. And C, hemodynamically stable low birth weight baby. And D, baby who is sick and cared under radiant warmer. And correct answer number is C, hemodynamically stable low birth weight baby. And लो बर्थ वेट बेबी कब कहलाएगा? जब वो 2.5 kg से नीचे होता है. Kangaroo mother care, KMC, is a method of care for preterms and low birth baby weight infants. It is involved skin to skin contacts with the baby and the mother, exclusive breastfeeding and early discharge from the hospital. The primary eligibility criterion for KMC is that the baby should be hemodynamically stable. Next questions. A 10-year-old child has been admitted in a pediatric medical ward with sudden onset of hematuria, oliguria, edema and hypertension. Which one of the following conditions the child is like to have? Option A, nephrotic syndrome, B, acute kidney injury, C, acute glomerulonephritis, and D, chronic renal failure. And correct answer number is C, acute glomerulonephritis. Acute glomerulonephritis is characterized by the sudden onset of the following symptoms which match the child presentation: hematuria, presence in the blood in urine called hematuria, oliguria means reduced urine output, and edema means swelling commonly seen in the face and limbs, and hypertension, elevated blood pressure which occurs due to fluid retention and the effect of the renin angiotensin system in the kidney. So correct answer number is C, acute glomerulonephritis. Question number 14. A 6-year-old child has been admitted in the pediatric medical ward such as the case of malignant tumor. Which one of the following is the most common in the above age group? Option number A, acute myeloid leukemia AML, juvenile monocytic leukemia, and C, acute lymphoblastic leukemia, and D, chronic myeloid leukemia. And correct answer number is C, acute lymphoblastic leukemia. Answer number C is the correct. Acute lymphoblastic leukemia, called ALL, is the most common type of cancer in children, particularly affecting those between the age of 2 and 5 years, but remains common up to 10 years of age. Acute lymphoblastic leukemia involves the overproduction of immune lymphocytes which crowd out normal cells in the bone marrow and can lead to symptoms such as fatigue, fever, bone pain, and bleeding. Question number 15. Match the list 1 with list 2 and select the correct answer using the code given below this list. Condition and symptom. Condition first A, hypertrophic pyloric stenosis, B, intersubstitution, and C, peptic ulcer, and D, appendicitis. And symptoms है bilious vomiting, B, projectile vomiting, C, pain in the right lower quadrants of abdominal, and recurrent vomiting. ऑप्शन यहाँ दिया हुआ है, तो इसका जो करेक्ट आंसर है फ्रेंड्स वो आंसर नंबर इज डी 2, 1, 4 and 3. अब यहाँ देखेंगे ऑप्शन नंबर ये है हाइपरट्रोफिक पाइलोरिक स्टेनोसिस is the commonly associated with option number second projectile vomiting, and option number B, intersubstitution is the commonly associated with option number A, first bilious vomiting, and option number C, peptic ulcer is commonly associated with recurrent vomiting, and option number D, appendicitis is the abdominal, and correct answer number is third number, pain in the right lower quadrants is of abdominal. So correct answer number is D is correct. 2, 1, 4 and 3. Next questions. Excessive stretching of a muscle and its facial set often involving tendon is known as option number A, strain, B, sprain, C, fracture, and D, green stick fracture. Correct answer number is A, strain. Strain, these terms refer to the overstretching or tearing of muscles or tendons, fibrous tissues that connects muscle to bone. Strain can result for excessive stretching, overuse, or improper use of a muscle. And sprain is the refer to the overstretching or tearing of ligaments, and fractures means these terms refer to break in the continuity of a bone, and green stick fracture, this is the specific type of fractures typically seen in children where the bone bends and partially breaks is called green stick fractures. So correct answer number is a strain. Next questions. Abdominal tortuous opening between the bladder and vagina is known as. Option number A, uretrovaginal fistula, vaginoperineal fistula, rectovaginal fistula, and vesticovaginal fistula. Correct answer number is option number D, vesicovaginal fistula. Vesicovaginal fistula, this is a abnormal connection between the bladder and the vagina leading to continuous leakage of urine from the bladder into the vagina. Second, uretrovaginal fistula, this is the abnormal connection between the ureter and the vagina allowing urine to flow directly from the ureter into the vagina. Vaginoperineal fistula, this is the typical fistula between the vagina and the perineum, often associated with the obstetric trauma or surgical complication. And rectovaginal fistula, this is the abnormal connection between the rectum and the vagina, allow fecal matter to pass into the vagina. So correct answer number is the D, vesicovaginal fistula. So thank you for watching friends. Have a good day. Jai Hind, Jai Bharat.